about 30 minutes for the webinar, and after that, question and answer time from about 15 minutes after all. Let me first say thank you for everybody to join us this evening. I'm happy to be a part of this webinar and to talk about this amazing technology, the Profound. For me, the only and unique bipolar radiofrequency microneedling real-time temperature-controlled device of the world. Long sentence. I repeat it. The only and unique real-time temperature-controlled bipolar radiofrequency microneedling device in the world. Of course, there are other devices outside, but no one of these devices are as good as the Profound, I think. First of all, some of them are monopolar and not bipolar, but none of them is temperature controlled. And what that means for me, I want to show you in the next few slides and about in this webinar. First, let me introduce myself. My name is Steffen Giesse. I'm an aesthetic surgeon from Ludwigshafen in Germany. Ludwigshafen is in the middle west of Germany, near Heidelberg, who's knowing Germany. I'm a well-known specialist for aesthetic treatments in Germany and also a speaker for different treatments and medical devices. And I've got multiple publications in national and international literature and also a lot of presentations during my time. That's the overview over the coming slides. First of all, I want to talk about the anatomy of the aging face, not a lot because everybody knows about this. Then about the science behind the Profound device, also about the science behind the collagen. Then about the technology of the Profound device, which is unique. Then about the clinical studies, the treatment by its own, and then I'm going to show you some before and after pictures before we talk about the summary and do the question and answer at the ending. That's the shape of the aging face as we all know it. The shape changes from the lovely V shape to the not so loved A shape during the process of aging. That's well known, and that's going to show us these, on the right side, these breech holes, these sacking on the breech holes, on the cheeks, on the chin, and also on the neck. And that's what our patients don't want to have, and that's why they're coming to us. Yes, what's happened? Why is it? What's the reason for this sagging? It's the collagen and elastin and hyaluronic loss in the skin and in the SMAS during the time, and that starts at our 20s, as we all know, and does not stop over the time. And we are trying to restore these collagen levels with our treatments. That happens then, the volume loss is appearing, the loss of tension, the moisture loss during the time, and lines and wrinkles and folds appears during that time. So what's the science behind the collagen? That picture is took out of a German literature. It's called Spektrum der Wissenschaft. It's about science on natural science. And here's shown the triple helix of the collagen. Yes, and these helix are bounded with hydrogen boundings together, and that's what we are treating. These hydrogen boundings. Botzek told us in 2011 that these hydrogen boundings, he did some special science for thermal denaturation studies in collagen by microthermal injuries with an anatomic force microscopy, and he heated meat, any kind of meat, and he showed that these hydrogen bondings between the triple helix of the collagen fibers is denaturated at 65 to 66 degrees. And that's a really, really interesting point of view, and we have to remember that later. So that's happening during the heating process, the collagen denaturation on the left side, the normal triple helix of the collagen, and then with the heat, the triple helix is denaturated and crushes out, and then there comes a little remodeling after cooling down, but the triple helix is not completely going back to the starting point. So there's an denaturation of this triple helix, and that's what other colleagues can show in clinical science here with this study, for example. That's Handage, an early study for the Profound device. And he took 22 subjects enrolled in this study, and he treated them with the Profound device. And he showed that these zones of denaturation collagen are coming after a few days of the treatment. And then after that, there will come a vigorous wound healing response from the skin. And at the end of this, there's a dermal remodeling process led to complete replacement of everything. 10 weeks post-treatment, the dermal volume, the hyaluronic acid and elastin content increased. Incredible. That's the science behind the collagen, what we want to treat. What we also have to know is where the collagen is placed in our skin. The collagen and elastin content is placed in the skin and the SMES, not in the subcutaneous fat or the adenoid fat layer or in the bone, only in this skin and SMES or plasma, it's called, and the neck. So facts so far, and I'm repeating that because I want you to be sure that you are got this with. As we know so far, the collagen, elastin, and hyaluronic acid levels decreases with age. The denaturation of the collagen and heterogen bondings happens at 65 to 66 degrees, as Botzek told us. The collagen denaturation is followed by an intensive or vigorous wound healing process and then collagen neogenesis. And that's what our goal is, to deliver this collagen neogenesis. The collagen is located in the skin and the SMES. Now something about the technology of the Profound device. The one and only real-time temperature-controlled bipolar radiofrequency microneedling device, as I told in this long sentence at the beginning. Here you can see the touch screen of the device. At the right side, the device by its own, and at the left side, the touch screen. And you can see that you can adjust the temperature to treat from 50 to 75 degrees. That's a long way to go. You are only needing, for my opinion, the decrease about 65, 66 to 67 degrees and not more. I'm gonna tell you that later why. Then you can adjust the time, the time for the treatment from 3 to 5 seconds, and you can have a look. You can for guides at the right side and treat, standby, and so on. At the left side, you see that the dermal tip is on set on the device, because here is the formation of the dermal tip needles at the left side in green. These are the two hand pieces of the device. On the left-hand side, the sub-Q handpiece. You can see long needles which are coming out in a 75 degrees angle from the device tip. And at the right side, the handpiece from the dermal tip with the cooling blade metal for the treating the dermal side. Let's see FDA improvement for the percutaneous treatment of facial shrinks for the dermal tip, also for hematostasis and electrocoagulation, but that's not really necessary for me. The treatment of the dermal and facial wrinkles, that's our goal. Here you can see how the device is inserting into the skin. You see this green-lined covered part of the needle. Here is no radiofrequency given. it's isolated only at the end of the needle, in a depth from 1 to 2 millimeters. There is a given radio frequency on this needle, on this pair of needles, and the radio frequency, the energy is switching between these needles. That means bipolar. And at the top, you can see the cooling blade from. Here is the cartridge, which you have to set on if you want to treat with the 5 pairs of needles. Well to see. So it goes. The other cartridge, the other handpiece is the handpiece for the subcutaneous treatment. It's called sub-Q-tip for the chin and body treatment. Here you can see the entrance of these needles, deeper one, from 2.9 millimeters to 5.8 millimeters in an angle of 75 degrees, also isolated in the green part of the needle and not isolated in the deep part of the needle. As I told you, it's a real temperature controlled system. So every pair of needles got a temperature control device idea. The needles are 32 gauge needles, so very thin, very small needles, and every 1 to 10 seconds the temperature is measured in the skin or in our treatment area, and so the device can work about the temperature, about the energy for health, the temperature stable to our gold temperature of 67 degrees, I think. The treatment profile, yes, that's also the temperature thing. Here you can see that on the right side that the temperature radio frequency when she's got on, that it's rising up to 3 seconds to the temperature of our treatment, to this 67 degrees, and then it goes back after stopping the temperature idea. So based on this real-time feedback of the device. Here you can see in the middle picture that the power at the beginning is very high. It starts and then it's going down as the temperature is coming up at the right side. When the temperature is reached at our ideal temperature, 67 to 70 degrees, here it's 70 degrees, then the power is not more needed in this high level. And you can see at the left side the impedance for that there is a little going up and going down, and that's the idea, or that's the thing that the device is always looking for the real temperature in the skin at our treatment area, and that look for that is fine and nice and not too high and not too low. So far to the science behind the device and the device by its own. Now the clinical science overview, and that makes results, and that makes trust, I think. These are 3 early publications about the profound device. You see it's always a group around Handtouch who is publishing this in Lasers in Surgery in Medicine. And they have looked for different things. First of all, in the first study, they looked for the temperature. They want to treat also in the second study. And in the second study, you can see that they started to treat between 60 and 80 degrees in this phase 1. But then they quickly changed in phase 2 to 70 degrees. And I wondered why they did something like this. And I think that's caused in the reason that they have seen there's only more side effects if they go in very high with the temperature, and they've seen that they do not need this temperature in this highness. 70 degrees, about 70 degrees is high enough. They also had a look for the temperature time, for the treatment time, and they did histological examinations after 10 weeks or 13 days in study 3. So what did they found in their studies? The first one with the 22 patients treated pre-auricular and in the abdomen by 72 degrees for 4 seconds, and they showed after 10 weeks the histological zones denaturated collagen, this reticular dermis with zones of spurred dermis up to 28 days post-treatment. They've seen new dermal tissue by 10 weeks, and they've seen new hyaluronic acid, new elastin, new collagen, and more dermal volume because of this vigorous wound healing process after the treatment. In the second study, as I told you, they had a look for the temperature they wanted to treat, and they changed it directly to 70 degrees in phase 2. And they have seen the same things, and they have seen that the 70 degrees is a good temperature for the treatment. And in the third study, with 15 patients, I almost think it's also the same patients every time. They had a look for the time they wanted to treat, and they treated about 5 seconds. They have seen that 69% of power was deposited in the dermis without spreading anywhere else. Only the treatment area was treated, and that's a good reason for the device also. Early clinical study on over 44 patients from Wiley, Kilmer, and Human had one fractional treatment on the face, and they measured the elasticity and did it by blinded photographs, blinded physicians by photos, and their results were amazing. They've shown then 100% of the patients showed an improvement in wrinkles. 89% of patients showed an improvement in skin laxity. 96% of patients reported moderate or dramatic benefit, and there was a significant improvement in elasticity after 3 months. The next study in 2010 showed a comparison between the profound treatment with a surgical facelift, and they showed that the profound treatment could reach 37% of a surgical facelift, and the satisfaction of the patients was very high. And the surgical facelift group, of course, had such a lot more downtime and compared with the profound group. The FDA improvement study was published in 2030 by Alexiadis, and this was a multi-center study of 100 subjects with a single pass treatment by different temperatures. But the mean temperature, and here think back for our temperature rate from Botzek from 65 to 66 degrees, the mean temperature that they treated was 67.7 degrees. And the treatment duration was 4.5 seconds in mean, and they also did a blinded assessment. The physicians had photos and had a look for the wrinkles and the skin laxity. Also, subcohort was discussed, but here too later. The results which was shown are amazing. Yeah. We had a 100% response rate for wrinkles with a 26% improvement on the Fitzpatrick wrinkle scale. We had 95% of patients with an improvement in skin laxity, with 24% of improvement, and we had over 90% of patients satisfied or very satisfied with the treatment by less adverse events such as bruising, erythema, edema, and so on. So the subcohort, and that's once more the temperature idea, the subcohort showed that at the temperature of 66.7 degrees and 4 second duration of treatment had a better improvement than another subcohort with more temperature and more time. So the improvement is the best at 66 to 67 degrees Celsius, and duration of treatment from 4 seconds about. Okay, that's the patient satisfaction only to show after 3 months and after 6 months, and you can see that the satisfaction of the patients after 3 months, it was satisfied or very satisfied, are rising from 87% up to 91% after 6 months. That's a real good satisfaction levels. And the authors told us as conclusion that the zone of the best denaturated collagen level is about 67 degrees. Okay, and last clinical study from 2015 also shows, published by Alexiadis, and also shows that the optimal temperature for the treatment is about 67 degrees. You can see here at arm 1, arm 2, and arm 3, low level temperature from 52 degrees over 62 and 67 degrees. And they showed after 3 months that I go to the next slide, that here you can see that the skin laxity in arm 3 is 100% better than at the beginning or before the treatment, and also the retides 100% better. And so they told us once more 67 degrees is the optimum of temperature for the treatment. And that's what I want to say is that we really need these temperature-controlled device to treat very well. And the Profound is the only temperature-controlled device in the world, device radio frequency microneedling device in the world. So what does it mean for my patients and for my office? A few years ago, before I had a Profound to treat my patients, especially in the lower face and the body, I'm treating very often the body. I had no good idea to tell them if they were coming with problems in the lower face without doing some surgery. I had other ideas, of course. Dratz didn't convince me. The Ultherapy device it's fine, it works very good, Ultherapy, but it takes a long time until the goal is reached, and it's gonna get very, very expensive if you treat a lot. And so I had no real good idea for treating the lower face, and that changed with the Profound device. Yeah. Now I got, what do I tell my patients during my consultation? I can tell them that there's a real device with a 100% response rate and predictable result. It's, in my opinion, it's the best option for treating the lower face without surgery. And also a nice reason for this treatment is that the device is only using the own body competence of natural healing processes for doing our treatment goal. Yeah. I also tell them that there's a little bit of downtime, that there's a little bit of discomfort during the treatment. That's sure I have to tell them, and we have to tell them that there's a little bit downtime for about 5 days, and that the results are not really immediately there. That's also a point we have to tell them, but the results will come and will be great after the time of 3 to 6 months. Also, I do some photos during my consultation, and I got my own PowerPoint presentation for the patients to show them how to treat and how to what they should expect of the treatment. The treatment by its own then starts, first of all, with doing some standardized before pictures, because of course we have to discuss the yeah, we have to discuss with our patients what will be and what they get after 3 and 6 months, and we also want to see what the treatment has done after this time. Then we go to the room, for a treatment room, and do no oral premedication or cream or local anesthesia or anything like this. We only do local anesthesia with lidocaine and saline, and we put this into the patients by a multi-injector or fanning technique, and then we start the treatment. And here you can see some picture of the treatment. You see at the left side that the dermal tip is inserted. The needles are in the patient. You can see it if you have a good look for that. And at the right side of the picture, you can see some small stitches, 2 or 3 stitches from the 10 needles, and a little bit of erythema maybe, and a little bit of edema following the heating during the therapy. That's immediately after the treatment. You can see some stitches, I think, also some erythema and a little bit of edema, but no bruising in this patient. That's not there. Here is a post-treatment diary of one patient during day 1 until day 6, and you can see at the pictures that there's at the left-hand side a little bit of bruising on the lower eyelid left, and on the chin, and some stitches, and you can see some redness at the right side. That's a normal patient, normal diary patient. Then here also at the day 4, a little bit of bruising in the chin area, but at day 5 and day 6, I think it looks very good. After 3 months, you can see that the skin has got better. Yeah, and here after 6 months, you see the chin area very much improved. Some more before and after pictures here and now. Here a picture after 3 months by an old lady, I think. And what we can see is an improvement of the skin texture, I think. Skin laxity, such a lot better. Here after 2 years after the treatment, it stood. Another old woman of 3 months after the treatment, post-treatment here with an improvement of skin laxity. Here a younger patient, I think, and I believe that the younger patients got more collagen. I know that they got no more collagen in the skin, and so we got more of this structure we want to treat, and I think that's the reason why we get better results. Here you can see a result, yes, of the chin area of the jawline 3 months after the treatment. Once more an older patient with a better skin laxity. Here an amazing result after treating the jawline, the pre-jewels, 5 months post-treatment. That's a really amazing result. Another one, an area hard to treat for us. We all know that this area is not easy to treat. Yes, the skin laxity 5 months after the treatment is very much better. Also here about around the eyes, the brow feet, better wrinkle scale, truly. Here treated also the acne scars. Such an improvement is quite nice during 5 months. Here also on treating of the pre-jewels. Of course, they are not gone, but we can combine maybe with other treatments or have a second session of profound treatment. Here also a younger patient with an improvement of skin. Here an older patient with the treatment of the pre-jewels and the nasolabial fold. A very nice improvement after 3 months. This one's also amazing. It's a very, very good result after 3 months. The next, it's in about the chin and the neck area after 3 months. Here's a picture of a man. We do not have to be afraid for destroying hairs or anything like this. One study before there was shown that that the other structures of the skin are not treated or not destroyed. Here, a picture before and after picture 3 months after treatment of the neck, and also an amazing result, and that's a really top amazing result after 6 months post-treatment. Also, chin and neck treatment after 6 weeks post-treatment, or this one also 6 weeks after the treatment at the chin. Another man. Here you can see from the front the better shown picture at the right side. Also, combinations are possible. Here are 2 pictures of combination therapies from Ridenur. He's combining the treatment with fat injections. I tried this also in one time, and I had a good result, I think, also with this. But that's not too long ago, so I've got to wait for the final pictures. But here you can see that the hollows in the cheeks are filled up with the fat, and the skin was treated with the profound device, and it's a nice result, I think. And here another one, additional treated with fractional CO2 laser. Yes, additional combining treatments are possible. Some before and after picture of the body that I told you. I'm doing that. I love to do that on the butt, especially on the butt, and also on the abdomen. Here are 2 pictures of the treatment of the abdomen, the first one and the second one, and we can see that there's a fine improvement of these structures also. Yes, at the moment, there are some additional clinical studies on the way. One of them to have a look for cellulite indication, to submit an FDA approval for cellulite treatment. I think that's a bit difficult. First of all, we have to talk about what is cellulite. I believe that the Profound device is a very good device to treat skin laxity, and if we talk about cellulite, we have to talk about fibroseptae, which are pushing the dimples downwards to the muscle fascia, and I believe that we have to treat them with a subcision. But if we treat the skin on top with the Profound and treat also the skin laxity, which is another problem on the butt, we can have amazing results in combining the therapy of the Profound with and subcision. I believe in that. And there are also other studies on the way for doing subcu and dermal combo treatments on the face, and to optimize the parameters for other indications. So, the summary in general, once more, what I want you to take home, that we have to know that the collagen, elastin, and hyaluronic acid levels decreases with age, that the denaturation of the collagen hydrogen bonding happens at 65 to 66 degrees, and that's why our treatment temperature from 67 degrees is a good temperature. I believe in that. That the collagen denaturation is followed by an intensive wound healing with a collagen remodeling process and collagen neogenesis, and that the collagen is located in the skin. Also in this mass, it's hard to treat this mass. We can treat with the subcu handpiece, but that might be a little bit too deep, I think, because 6 millimeters is in depth where nerval structures take place, and it's a bit difficult to treat there. So the Profound device is the first and only device with temperature-controlled radiofrequency treatment. That's real time. There's real-time feedback for this temperature controlling, and this is the main reason for the device. The Profound creates new collagen. The studies show that creates new elastin and hyaluronic acid, and so we get more dermal volume and better dermal. A better dermal situation. We've got a 100% response rate for ritis and elasticity at 67 degrees of Celsius. That's it. The treatment duration between 3 and 4 seconds is, I think, the best one. And here are my final thoughts. There's a science behind the device. That's absolutely sure. We have proven results, and we have, with a profound and effective treatment, especially for the lower face and the body. Okay, thank you all for your attendance, and now we can do some question and answers. Okay, I repeat the questions and then I answer them. So here's one. What about the price? What do you charge for a treatment? Okay, first of all, I think the pricing depends not only on the prices we have to pay for the device or for the cartridges or anything like that. We are selling results, I think. So we have to measure the price or put the price in a level together with other treatments for the lower face, for example, and that's not really only to tell for Germany. I think in other countries there should be other prices. In our office, the price is at 1,200 euros for a facial treatment and about 2,500 up to 3,000 euros for a body treatment. Yes, that's it. Next question. With which other therapies do you combine the treatment? Okay, that's a very, very good question, and fortunately a very long answer, I think, here. So first of all, what I did is the first way to get my experience with the profound device, I treated body indications. And I treated body indications, for example, post-surgery for an abdominoplasty, where I had no really good results or not, where I thought you could get better results with a little bit more skin tightening, and I tried that, and I made my way, and that's a nice thing, and I combine it, yes, anytime or very often during abdominoplasty. I also combine it on the butt with the subcision, as I told you. In the face, I combine it, I think, with every treatment I offer for the face. Why not? Also with fillers, with botulinum toxin, also with ultherapy, for example. If I treat the ultherapy in the area of the eyes, I love this treatment with the ultherapy, and then I could treat the lower face with the profound, because I believe he makes the better results there. What else? Also with lipotransfer in the face, yes. That's a way. I combine it also with liposuction on the body, sure, of course. The next question: can you please re-explain the possible treatments with regards to abdominal, facial, and neck contouring? Can a non-medical professional administer these treatments? So the question is for delegating, I think, this treatment. I do not delegate this treatment in my office. Sometimes I delegate it in the operation room when we are treating the butt with a subcision for cellulite, and then we start treating the opposite side of the butt with the profound device. That might be possible, but in delegating in the face, I do not. I don't want to delegate this treatment in the face. Next question: how many lines do you treat during a treatment? That depends on the treated areas, of course. In the face, we start with 150 lines, 50 each cheek and 50 on the chin. but it could grow up until 400 or 500 lines in the face, and on the body there's much more possible. I remember my biggest treatment on the butt in combination with substitution by cellulite. It was about 4,000 lines, I think. Would you follow up the treatment after 3 months with other energy devices? I never did anything like this. I waited up until the 6 months for the final results. But it's a good idea, I think, to retreat after 3 or after 6 months. I think that there is a better improvement of skin laxity, of collagen neogenesis after this time. If we treat after 3 months and second time. Yes, I would love it, and I will do it in the future, and I will have a look for the results then. But I did not do it such often to tell you more about this. Okay, fine. So there's no more question left. I want to thank you, everybody, for your attention. If there are coming some more questions after our webinar, please feel free to contact me by email or whatever. You see my logo here in the screen, and you will find me on the internet. But also you can get in contact with Candela, and they can get you in touch with me. Thank you very much. The webinar now stopped. Goodbye.